everyone, welcome back to the channel. If you're new here, I'm Jazz, an Australian trained radiologist, and today we're diving into one of the most frequently asked questions I get. So I want to be a radiologist, what should I expect? Whether you're a medical student thinking about specialties or just curious about radiology, this video will give you a no fluff overview of the path, lifestyle, pros and cons. So let's get into it. So first up, let's talk about the journey. Becoming a radiologist isn't quick or easy. You go through med school, then you do your initial foundation years, whether that is F1, F2 in the UK or intern residency in other places such as Australia. Then comes specialty training. In Australia, it's 5 years of radiology training, potentially followed by a fellowship if you're subspecializing. In the US, it's generally pre-med, then med school, then a 1-year internship followed by 4 years of radiology residency, and maybe a 1 to 2 year fellowship. The training is intense. You're learning anatomy, pathology, imaging physics, and how to interpret a massive range of scans from x-rays and CTs to MRIs and ultrasound. And then there's the practical side, doing procedures like biopsies, injections, and drainages, to just name a few. A lot of people assume radiologists just sit in dark rooms and stare at images all day. That's only partly true. Yes, we do spend a lot of time reading scans, but our role is much more dynamic. We're constantly communicating with other doctors, answering clinical questions, advising on next steps, and sometimes getting called into emergencies. For example, if you're an interventional radiologist, there's also procedural side of radiology, especially in interventional radiology, that involve guiding catheters, needles, and wires through the body using imaging. It's very hands-on and high impact. In a majority of countries, non-dedicated interventionists or diagnostic radiologists will still perform a wide array of procedures. Now, depending on your subspecialty, you might focus on, say, neuroimaging, MSK, pediatrics, breast, or even forensic radiology. Depending on how academic your practice is, you may just end up reporting your subspecialty. However, there are many general jobs which will still allow you to pick up as much work from your subspecialty you want as well. So you can definitely tailor your career to your interests, which is a huge plus. Radiology is known for having one of the better work-life balances in medicine, if you set it up that way. During training, there will be on-calls, which can be intense, reporting traumas and strokes, just to name a few. But in general, you're not doing night shifts as often as, say, A&E or surgery. Teleradiology and private work are also options once you finish training, which add flexibility. If you're someone who values time outside of work, radiology gives you some room to breathe, at least more than a lot of the other specialties. So pros, here's a quick list of a few: intellectually stimulating, high impact decision making, good earning potential, flexible career path. Some of the cons: steep learning curve. Your junior years as a doctor don't really prepare you to be a radiologist or know how to report scans, whereas transition from a junior doctor to a first year medical registrar is probably more relatable at that stage. It can feel isolating. There's a lot of sitting at computers and just reporting scans by yourself. Next, less direct patient interaction. You will interact with patients when you do procedures, but those interactions are quite brief naturally. And then high responsibility. A lot of other clinicians are depending on your interpretation of the images to first work out what's going on with their patients, and then secondly, they will base their initial management and treatment on your findings. At the end of the day, radiology is not for everyone, and that's okay. But if you like problem solving, working across all specialties, and the idea of being a doctor's doctor, radiology might be a great fit. So there you have it. Radiology is a fantastic specialty, but it comes with its own unique challenges and rewards. If you're considering it, shadow a radiologist, ask questions, and really think about what you want your career to look like. If you found this helpful, give the video a like, subscribe to the channel if you're new, and I'll catch you in the next one. Cheers.
Thank you.